My talk today was about domestic violence and traumatic brain injury, and this is based off our program we developed in 2012, and it's a partnership with local homeless and domestic violence shelters. So when victims and residents enter the shelters, they are screened by the shelter workers for potentially a history of traumatic brain injury, as well as symptoms ongoing from their injuries. And if they have concern for that, the victims are then transferred to or referred to our clinic, and we provide the same kind of comprehensive care we give all the rest of our patients, and this is done free of charge to the patients, no matter what their insurance or financial status is, because we have several grants in place. One of the best things about this symposium is it is very focused on what many of us do daily. I'm a physician, and there's several other clinicians here and bench researchers and people from all over the country who work in the traumatic brain injury field. But as we learn, we first of all, we don't know a whole lot about traumatic brain injury and concussion in the grand scheme of things. There's so much we still need to understand. But what we're learning more and more is everyone's brain is different, everyone's injury is different, and there are some pretty distinct differences even just between males and females that right now isn't always clinically applicable, but hopefully as we understand more it will be, and it makes it easier and more effective when we treat our patients. So our presentation was based off our study that we've done with our domestic violence population, and we had 115 patients in our study. 95% of them were female. We looked at symptoms, medical history, and abuse history. The most common symptom that was complained of was headache, although the mood and behavioral symptoms were the most severe on a severity scale. 81% of our patients reported so many injuries that they lost count of them, and then of all of our patients, only 21% had sought medical care by another provider in the past. And so this study was really kind of our introductory study, looking at our population as a whole to look at things like injury history and symptoms and what kind of things they're experiencing, so that this is the launching point for our next few studies, hopefully looking at maybe some more objective measures in this population. The topic that I found pretty interesting was actually the session right before mine. That was all the hormonal differences between males and females. These are hormonal differences we've known about for years and years, and the science has evolved as far as what that means clinically, not just in brain injury, but in other injuries and illnesses and things like that. So it's nice to see that evolving over time, and because the more we learn and understand about the hormonal differences, the easier it'll be to interpret what we're seeing and actually treat our patients in an effective way based off some of those things. Great. One of my favorite things about conferences like this is to have everybody in the same room that is researching overall the same goal. And for this kind of conference, it's gender differences in traumatic brain injury. And there are people who are, kind of frontline providers, physicians, nurses, athletic trainers, people like that, all the way down to bench researchers and psychologists and other people who treat our patients. So to see so many different groups of people across the country doing different types of research, it's going to be able to help our patients from a clinical level, which is really the goal. And the more we have symposiums and conferences like this, the more we're going to learn and be able to collaborate together.